Just start.
Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why. Good evening, everyone, and welcome to Pause for the Truth podcast, where we bring you meaningful conversations that inform, educate, and empower, and strengthen our communities. Dr. Kane, I don't know why I wrote a script because I'm used to just talking on the cuff, right? 4 decades of being a health educator, I should have it by now. I don't really need a script, but tonight's topic is incredibly important as we recognize National Infant Immunization Week. Our topic for the evening is protecting our future, infant immunizations, and community health. Our expert speaker, as you can see him on the
No, I
screen,
cannot even see anybody right now.
technical difficulties, so we
A
can hear
minute ago, I
him,
could see
but
everybody
he
and I could
can't
hear the
hear
music and the
us.
introduction. I can,
So
right now, nothing.
we're going to hear him talking, but so forgive us as we work through these technical difficulties. So, Dr. Kane, how are you doing this evening? And we're just going to wing it until Dr. Rathor can come
Yeah,
on.
because what I got to say is not as important, anywhere near as important
Right.
as Dr. Ratho has to say. However, I am enjoying this. I'm not going to say the final day of this really nice weather, because I do think that if I've heard or seen on the weather where the temperatures are going to begin to climb. And I always can put on more clothing. I just can't take off enough
Not
and not go to
legally,
jail.
right?
And so, so but I'm excited to hear from Dr. Rathor. And I'll repeat it when Dr. Rathor will get on. I'm on the other end of the spectrum for whom the people that he take care of, these infants and babies and the young folks, and I'm going way on the other end of the spectrum. However, immunizations on both ends of the spectrum are very important. But because I have no expertise in pediatric immunization, I really wanted someone on here like Dr. Rathor, which you're very aware of who he is. Really wanted someone like Dr. Rathor, who is the epitome of an expert in this field. You can't find much better expertise than Dr. Rathor.
Right, I know. And Dr. Kane, I was talking to someone the other day. They had a friend or family member who was diagnosed with COVID, and they were surprised. I don't know why people are surprised that the COVID diagnosis is still possible,
Right.
because nobody ever said that it went away. I didn't.
Right.
Did you say that it went away, Dr.
No,
Kane?
I never said it went away. I might have said the circumstances have improved, but I'm also seeing
we reached herd immunity.
Yeah, I'm still seeing RSV infections as well. I had one last week, respiratory syncytial virus. Last week I had one, and of course I'm not dealing with infants, but it was an adult, and it was a little bit distressing to them. And then of course the more immunodeficient you are, the worse it can be. So I'm
afraid. It's so funny when someone comes around me, Dr. Kane. We're talking about Infant Immunization Week, but when someone comes around me with school age children, and I don't have a mask on, I get nervous. Or when I'm in church, and a bunch of children sit around me and I don't have my mask, I'm like, oh Lord, because I know now that parents have the option. They always have had the option of getting their children immunized or not. Right. And even thinking about when I hear someone coughing and I don't have on a mask, I just freak out, right? I'm just like, oh Lord, this is why I wear my mask. And that's why we chose to talk about immunizations tonight, although our focus is going to be on infant immunizations, because we like to recognize those national health observances, and this is National Infant Immunization Week. And so when we thought about having this conversation, we know that parents have always because of religious purposes, opted out of getting their children immunized. And of course, we want it to be parental choice to have make decisions about their own health or the health of their children. However, what we try to do through this forum is to share with people some information from different experts so that you will get a more informed decision maker about whatever choice you made. At least you know you did your homework. And what we do is we find people who have reputations in the community of being trusted experts, and they come on and share their perspective so that when you're making or navigating the healthcare system, you then know how to make decisions for your own health. One thing that has really, I want to pivot for just a moment, Dr. Kane. I don't know if I know you had gotten a call, but I wanted to talk to our audience a little bit. I want to get off immunization a bit as Tyrone works with Dr. Rathor, and talk about this fire situation that's happening in our community. So if you have patients, because you mentioned that most of your patients are geriatric or elderly patients,
Right.
but just in general, if people have COPD or some lung issues,
Asthma.
can you give them some advice of how to navigate this if they happen to be in an area where there's a lot of smoke?
Yeah, that's a bit difficult. First of all, the most common rule is stay inside as much as you can.
Yeah.
Okay. If you have to go outside, then I guess signs of COVID, but you may want to wear a mask. It can help some. Doesn't have to be that N95 or whatever,
Okay.
but some type of a mask to help out. But the biggest thing is to stay inside. If you have something like asthma or COPD, just go on ahead and use your inhaler. Don't wait until you actually start having difficulty breathing.
Mm-hmm.
Use your inhaler ahead of time, and it may prevent that difficulty in breathing. And it depends on the severity of those who have the severity of the asthma or the COPD, which, some people think about emphysema as well when we talk about COPD. Those individuals, those are the three main things when it comes to pulmonary concerns. COPD, chronic obstructive pulmonary disease, emphysema, and asthma. Asthma is a big one, as you already know. And that COPD and emphysema, we tend to see in the older population because their lungs have faced the wear and tear of trying to deal with the complexities of life between smoking or being around people who smoke and that kind of stuff.
Or any environmental like work
environmental stuff, right?
People were exposed to things.
All that is due to exposure. So the older you are, the more likely you might get exposed to some of those things, including asbestos or asbestosis, as we know in terms of the disease in itself. So all of those things, if you start realizing that an individual has those, that you are one of those people that fit into that mold or one of your loved ones fit into that mold, you really want to help protect them as much as possible. So a lot of preventative is we can best see it. We have what we call long-acting asthmatic type medications. A lot of them include steroids, which are not inhaled, so you don't have to worry, ladies, you don't have to worry about getting fat or nothing along that line, because they're the ones most concerned with it, more than guys are. But those things are more preventative. And then you have the one, what we call a rescue inhaler. That's the traditional, what most people know about is albuterol. Or Proventil is the other name for it. If you have a nebulizer, have used a nebulizer in the past, go ahead, make sure your medications are up to date. Make sure these inhalers are up to date. Get you some fresh ones if you haven't used it in a while, because a lot of times when you don't use these things for a minute, they tend to expire. And a lot of times people just only see it come wintertime or during extreme heat. But we are at that point where anything can happen when you get exposed to all that smoke and stuff that we're tend to see. Luckily, so far in metropolitan Duval, we hadn't had that kind of an issue. The smoke has not came in our direction, but wind direction can change in a heartbeat. So be prepared more so than waiting until the last minute when you really need help. So go get a refill on your prescriptions if you're using inhalers, even if you don't use it every day, and make sure those inhalers that help protect you from going into these crises, that you have them as well. Check with your physician and see if there's anything that you may need because of your specific condition, because what we're talking about is generalizations. Okay. Does that make any sense?
Makes a lot of sense. Tonight, if you're just tuning in, our topic for tonight was supposed to be on infant immunization, and Dr. Kane and I certainly aren't experts in the area. So again, we're just going to pivot, Dr. Kane. And before our guest, Dr. Rathor, hopefully the behind the scenes guys, you can see up top, Tyrone Jackson is working behind the scenes with the doctor. I want to talk about another important topic, Dr. Kane, because it is National Minority Health Month. And when we think about minority health, you know, health doesn't start in your office, right?
Nope.
A lot of things relative to folks' health started where they live, work, and play. And so people have to be cognizant of the fact that, sure, they can go to a wonderful physician like yourself and many other physicians in the area. However, it's not your sole responsibility or only your responsibility to help me manage my health. Right. We have to bear some responsibility of it. But when we talk about the, folks going in seeking medical care, I think about historically in my own family, the diseases that were prevalent. When I decided to major in health education in college, the reason that I did is because I looked at the health of my own family. I saw the elderly people in my family. And I know that years ago, access to care was a bigger issue than it is now. It still is a big issue, but it was. I was in a meeting earlier today and they were talking about, because of the price of insurance, a lot of people have had to make a decision. Do I pay for groceries and housing, or do I keep my insurance? And they just cannot afford to continue insurance. But when we talk about minority health, unfortunately, there are certain diseases that are so prevalent, and I'm speaking primarily in the African American community. There are certain diseases that are typically prevalent in our community. And in many cases, it's also across the board for the general population. And so that is, of course, diabetes, cardiovascular disease, cancer. And if anybody who's listening think about it, those are diseases that we can do something about. We've talked through many podcasts in the past that we didn't choose our parents, so we can't do anything about hereditary. However, heredity. However, when it comes to lifestyle choices, that's where we can make a difference, Dr. Kane, so that we won't end up as a statistic on the list of persons who've been diagnosed with diabetes or diagnosed with high blood pressure or cancer. Because again, there are just so many things that we can do and the things that we can't do. Environmentally, there are some things we can do and some things that we can't do. But I just want to pivot a bit as we wait for hopefully Dr. Rathor can get on, but if he can't, we certainly will reschedule him for in the future. But what are your thoughts, Dr. Kane, when you hear about it being National Minority Health Month? What comes to mind for you? And I'm going to ask you, I'm putting you on the spot by saying, what in your answer also talk about what it is that two things. Number one, what are you seeing the most in terms of the diseases that are most prevalent in your opinion of, and you don't have to speak of your patients, but as you know, with minorities. And then secondly, how can we be better managers of our health and not solely rely on primary care physicians such as yourself to help folks with managing these diseases? I know that's a loaded question, but
It is questions, plural.
questions, yes.
All right, so let's start with this. Let's do it this way. Those three or four top diseases that we're looking at in our community, definitely diabetes, high blood pressure, and elevated cholesterol. That triad can do a whole lot as it relates to cardiovascular disease, number one killer amongst all Americans. But we have a significant lead in terms of African American communities just for that. Okay. But when I look at it and I start thinking about how do I prepare my patients for it, it's three different things that I kind of look at. We look at prevention, okay, which includes the area of immunizations and then health habits that are the right thing to do. When we look at the dietitians we brought on and they start talking about some of the different things that occur as a result of our diet, and so on and so on. So prevention, as much as we can, not to get to where we need to monitor the diabetic as much as it is prevent the diabetes. That's that. Two, the other thing that we want to look at is early detection. So that's why you need to see those physicians in terms of making sure we get the early, as early detection as we can that's feasible within our lifestyle, that's feasible within our access to health related testing and yada, yada, yada. And then the last thing, but not necessarily the last thing, but it being more inclusive of the first two things is education. Really just being educated on these topics. Then that also helps for those people to start being aware of early detection and things to prevent it. You kind of stepped into something that I would have talked about later, but I'm gonna throw it out right now. That is what we're looking at. Pause for the Truth, bringing in our health channel, our television health channel, in the very, very, very near future. Okay, in which we're going to start doing broadcasts, of different events. We will be one of the few, not one of the few, maybe the only health channel dedicated to minority health. Okay, in particular those in the African American community. So it's just a matter of time, and we want to have people stay tuned. I don't know how I'm just looking at this thing. All of a sudden, I noticed why is Pause for the Truth reversed on mine, but that's another subject. I thought for a minute I was cross-eyed. But those things, education, early detection, prevention, and being aware of those top 3 or 4 items are a significant. Lung disease, that's where you start looking at the emphysema and stuff of that nature, obviously, and so on and so on, if you catch my drift. So I think we just really have to stay on top of it. We in this case, we're looking at very young, and that's why we're looking at these immunizations, looking at the very young, but we also got to remember the very old, which also has it also have a concern about their immune capability, the system for the immunity. We have to look at the very old because they're kind of like the very young. They're susceptible to certain diseases that those of us, when we're in that, I ain't gonna say us since I'm old now, but those individuals who I know middle ages, early youngsters, and so on and so on, who have a better immune system than us older folks and the very young. So we have to start looking at those items in terms of trying to make sure we do not succumb to things that we can prevent. So if we can, and that's one of the reasons that we're having this program at the moment in terms of immunizations. We're on that end of the spectrum where the very young, we're trying to do more prevention. And immunizations is a key to prevention. I know they've taken a beating lately in terms of Dr. Rathor, can you hear us? Dr. Rathor is still having some technical difficulties.
Yeah, and I'm glad you mentioned, and I think I wanted to, when you were talking about in terms of protecting ourselves, and vaccinations are a way to protect ourselves. Do you still tell your patients, since that's our topic for tonight, that's not all relative to minority health, and we can come back to that certainly when Dr. Lathor comes on, but when it comes to vaccines, what vaccines do you typically tell older folks to take nowadays?
The most common ones that you see being promoted is RSV, respiratory syncytial virus. We're still giving COVID vaccines, okay? Because people still can get sick and die from COVID, even though the veracity of that virus is not as bad as it was with the initial one. But still, because of our compromised immune system, we can still succumb to the effects of COVID. Things like shingles, even though most people is not killing them, you know, sometimes I
don't
hear
want to get it.
yeah, some people wish like, man, I think sometimes I want to blow my head off because of if the shingles affected their eyes and stuff of that nature. It can also cause blindness, yada yada, that type of stuff. So a lot of people take a look, and we're trying to do those more preventative things that keep patients from dying and to keep them as comfortable as possible. So the shingles vaccine,
I think about tetanus, diphtheria.
tetanus, I was going to go down those
CDP.
right. Yeah. There's certain criteria for tetanus, every 10 years, unless there's a reason to do it sooner, and so on and so on. So there's a lot of other things that we can be immunized, but the most common you hear from the Walgreens and the CVSs of the world, are they really trying to get you out there to get the RSV, COVID, and shingles, and
flu, right? Influenza,
flu, pneumonia. Pneumonia still is a significant killer amongst older adults.
How often are you supposed to get a pneumonia vaccine? Is it
Well,
every
it depends on which one you got last, but we start reviewing it at least every 5 years. We start reviewing, do you need it? You check with your pharmacist, give them what your current vaccine situation is as it relates to pneumonia. And then that pharmacist, who is very aware of the guidelines for that, will help guide you in terms of when to get the next vaccine. We try to give them to anybody when they get into the office, and it's an opportunity. Many offices try to get them situated that, especially if they have certain health conditions like COPD or emphysema. They're more likely to need these vaccinations than others. Everybody should get them, but there's a critical number of people, a critical category of people that they need not to be without them.
Yeah, I know. I also, when I was at the health department, I got the hepatitis A and B vaccines.
Yeah.
And it's not something that typically, and I know that having worked at the health department, we were knowledgeable about different vaccines, but generally, I just don't know how many people are told they need the hepatitis A and B vaccines.
Right.
Is that generally just for healthcare workers? Is that why it typically was offered? I think that's why it was typically offered to us.
Especially healthcare workers, because they were most acceptable to it. People coming out of office these days, and you're gonna, there may be people who disagree with it. People coming out of office these days, and they see us still wearing masks, and they're going like, Dr. Kane, why you guys are still wearing masks? COVID, is not that big of a deal. It's like, okay, I understand what your viewpoint is, because people telling you the era of COVID is over, which I don't really necessarily believe completely like that. But our thing is, the most common place where you see sick people at that can possibly infect others, okay, is hospitals and doctors' offices. Because that's why people come there, they're sick. We wish they only came because we want to do preventive services, but that's not the case. Okay. We wish that was the case. But because sick people are there, I don't want to go in and see a young lady, male or man, whom has, I say COVID, but it could be the flu, whatever, who has the COVID or the flu, and they're coughing all in my face. And then next thing I know, I go see an elderly person who now I'm in their face, and may be giving them
Mm-hmm.
that same disease that I just came in contact with. That's one of the reasons that we still wear masks in our office. I know it's not one of those things that people wonder, why are you still wearing masks? The era of COVID over is what some people say, but nope, that's not the only reason.
Yeah, I know. I still do. So I'm not sure Dr. Rathor is on. Dr. Rathor, you're muted. So can you say something? Can you hear me?
Good evening.
Ah,
Yay!
We made
Finally.
it. Kudos to Tyrone.
thank you, sir. Well, we most certainly appreciate you being here. You're when it comes to the matter of immunology, one of the most respected people I know that I have for sure is
Yep.
Dr. Hathor. I always, he says, call me Mo Bean, but I give him the respect that, I think he deserves because he is so knowledgeable and he spent so much time trying to take care of others in the community, probably at the expense of his own family to a degree. And so we not only thank him, but we thank his family for allowing him to be at providing the services to our community, and especially the kids, because he's all about taking care of these kids and making sure that they grow up to be as old as we are.
Thank you. Thank
Yes,
you.
thank you, Dr. Rathor. And listen, since we only have 28 minutes left, forgive me, but I'm gonna dive on into it. So welcome and thank you so much. So I want to ask just a real get a real foundational understanding. Why are infant immunizations so critical in the first 2 years of life?
Jocelyn and Rogers, thank you so much. First of all, it's always a pleasure working with you guys. I think it's important to remember that children, when they are born, they are not born with the full protective armor that you and I have. And that's why they get increased risk of infection, get more infections. And as you know, over the decades and centuries, kids have died, when they were infants. And that's not changed uh, at all.
What the heck?
And
Uh-oh.
I think it's important to remember that vaccines provide them that ability so that their bodies can then fight these deadly, horrific infections.
We
So
can
what
only look at,
diseases? Oh,
I'm sorry, we can only look at before vaccines, what type of mortality, morbidity, the sickness and death rate that occurred with certain diseases, as simple as measles, that we took
Yeah,
for granted
yeah.
for a while.
Rogers, I think I'm old enough to remember I grew up in a poor part of the world where I have seen the devastating diseases. I even saw one case of smallpox in my family when I was very young, but
Wow.
I've seen plenty of cases of polio, and my friends and my relatives who suffer from it and have paralysis and died of it, and seen tons of cases of measles, which I had measles, I had German measles, I had mumps, I had chickenpox, I had whooping cough. In fact, we used to call whooping cough the black cough. And so I've seen all of those, which was part of, even though there were some of these vaccines available in the United States, where I lived, that was a part of the pre-vaccine era. And then I came to the United States, and it was so wonderful to see all these kids being protected. And then we still had Haemophilus influenza meningitis. That meningitis that devastated. We see kids with that. We had chickenpox. Kids with serious chickenpox in the hospital, and kids with pneumococcal meningitis. Remember rotavirus. In
Yeah.
the winter, the offices in the hospitals were full of rotavirus patients. And now these vaccines came in, and that was the real vaccine era. All of this vanished. People used to say, pediatricians are going to drive them out of business. I said, wouldn't that be wonderful if kids didn't get sick? And so we did that. And, even in our own, we have shown data in our own community in Jacksonville, where, give you an example, Haemophilus influenza type B vaccine became available for infants in October of 1990. By 91, 92, the infection had plummeted.
Right.
And then the last, then about rotavirus, the same thing. The rotavirus vaccine came, and we don't see kids in the hospital with rotavirus. So much so that the hospitals don't even offer the rapid rotavirus test in the hospitals anymore because it's not necessary. And
Right.
now what do we hear? We see cases of measles right here in Jacksonville. We see cases of meningitis around the country. Now we are CDC saying rotavirus is going up because people are not getting the vaccines. We had a case of tetanus just a few months ago here in Jacksonville. We have seen 7 cases of measles in Jacksonville. We have had a case of congenital rubella syndrome in Central Florida, not in Jacksonville. So I'm concerned that we are now getting into the post-vaccine era, and we're going to start seeing these horrific diseases come back again.
So what
All
would you
because
say
of
to,
misinformation. But go ahead.
what would you say, Dr. Rathor? I have a couple of relatives who are expecting, well, relative and friend who are expecting now and expecting a baby. What would you say to them as they then have to make the decision to get their children vaccinated or not?
Well, very important. I just became a grandfather about 5 months ago, and so I can speak to
Congratulations.
that. Thank you. I can speak to that. First of all, the pregnant women should get the vaccine. They need to get the DTaP vaccine for diphtheria, tetanus, and pertussis to protect them. They can also get the RSV vaccine to protect them. And when the babies are born, just remember the baby comes out of the protection of the mother's womb. God created that perfect room for the baby to be protected. When the baby comes out, our bodies, God has made them are perfect machines. We can face all these challenges of all these various things that are thrown at the babies. But there are certain things the baby's immunology has not established thus far. And most of them are these infections for which the baby cannot mount in protection. We have to remember that the babies just cannot mount protection. And the reason we give these vaccines at certain ages, because we need to start protecting the babies before the risk of infection. So we give the meningitis vaccine at 2, 4, and 6 months. Why? Because babies get infections after that. Because for the first 6, 7 months, they still have the good stuff from the mother that's protecting them, but it's going to go away. So I think measles vaccine we gave at 12 months because we want to wait till the mother's antibodies go away. That's another reason women of childbearing age must get their own vaccines. So I think to the new mothers, new parents, new grandparents, I would say that, listen, I'll make it very simple. There's nobody dear to me than my own children, perhaps my granddaughter now. Nobody's more dear to me than that. And my children have gotten every possible vaccine. My granddaughter is getting every possible vaccine to protect her. So I cannot give you a better recommendation. Do you think if I thought for a minute that these vaccines could hurt my children and grandchildren, that I would let them near that? Absolutely not.
So what are some common concerns or myths you hear from parents in terms of their hesitation about getting their children vaccinated?
Yeah, the vaccine hesitancy is unfortunately being fueled by a lot of misinformation, and unfortunately, that misinformation often came from people, who were, just concerned about it, and then there were some celebrities. But now, unfortunately, people in power are talking negatively about vaccines, so they're getting all this misinformation, and things like, oh, the baby's body is not safe enough to respond to these. That's not true. Our babies are being subjected to all sorts of things all the time. All we are saying with the vaccine is give your baby a chance to fight away these infections. And I think that's something we can always count on parents to make sure that they give the best to the babies. Now, we talk about parental rights. Well, what about the baby's rights?
Right.
Babies have a right to live. Okay, what about I'll be very blunt. You would not let a parent hurt the baby, or parent hurt the baby by, let's say, not putting them in a car seat, or leaving them alone at home. So same way, how can we let parents or how can we let the babies not be protected with something that is so simple and easy? These vaccines have been studied, and they've been studied. There was also, unfortunately, anti-vaccine uh, activity in the United States is not new. You read history; they were opposed to smallpox vaccine. Even Jenner, when he had his first vaccine in the Western world, the first vaccine, the cowpox vaccine, people were opposed to that. And then, unfortunately, in the most recent past, in our professional lifetime, we had this the fraudulent study published in Lancet by a doctor who said measles vaccine causes autism, and then he retracted that. The study was retracted, the journal retracted. There were editorials written on that this was a fraudulent study, but unfortunately the damage was already done, and this misinformation continues. And we as physicians, we just have to keep doing the best we can.
One of the things that I can say that parents, most parents, if they were faced with a situation where a gunman has drawn a gun on them and their child, the first thing they do is put themselves between that gun and their child.
Yes.
And this may be an over dramatization, but we're so adamant about protecting our children from harm, and the right disease can kill you just as well. I'm gonna say wrong disease, maybe that's not the right thing we put it, but can kill you just as dead as a gunshot can.
Yeah, listen, Rogers, you're not being dramatic. We have a big gun violence problem
Right.
in our country also. And I'm not trying to minimize that, but a gunshot to the head will kill you right away, right?
Right away.
And but a meningitis bug in your brain will make you suffer and then kill you. I think it's even worse in many ways, because everybody suffers. The child suffers. I mean, you we all have seen. Jocelyn has been in public health for a long time. We have seen these. Now, if those kids, if they don't die, they ended up being devastated. How many kids have we seen who are devastated by meningitis? So it's just, I mean, I don't blame the parents. I'll be very honest with you. I don't blame the parents.
Right.
I think it is the media, the misinformation. Yes. It's those people who can influence them. And now it has become sort of part of, unfortunately, people in power who are also saying, oh, vaccines are bad. And, people, parents are confused.
Yes.
And there's an onslaught of misinformation in the media. And, once you start hearing that, it's hard for the parents. I really feel bad for the parents.
I can remember, I'm old enough, as probably older than you, Dr. Rathwell, but I'm old enough to remember. I'm old enough to remember the effect of whooping cough and watching a kid on the ward when I'm doing, and I just felt so helpless. Or the RSV virus, where you feel so helpless because you can't treat them. But then we don't have to let them suffer through that if we gave the vaccine. Okay, right. Back then, when I first started looking at some of the vaccines were not necessarily available, particularly for RSV and stuff. But I remember just being on the ward doing the rotations, and it was the most disheartening thing I ever seen. I just could not help. I wanted to, but there was nothing I could do.
Yeah, and I think that's the point to make. Even though we may have antibiotics and such, these bugs, when they cause the infection, often it is too late to fight them. They call some, the last cases of Haemophilus influenza type B meningitis we saw in Jacksonville was in December of 2016 and January of 2017. And wow. I was really afraid it's going to come back. Fortunately, we didn't see any after that. Both those children, one of them, the parents were not vaccinating. The other one, the parents were vaccinating, but were delayed in the vaccine for various reasons. And I tell you, those parents were devastated.
Yeah.
Those parents knew that they could have prevented this. Yeah. And, and then we have, so I think this is something that, once you see it, it's unfortunately too late. And the other thing is, we don't see these diseases. A lot of people think, oh, these diseases are somewhere in Asia and Africa and under-resourced parts of the world. No, these diseases are here. There were 150 cases of measles in Florida. Wow. And they were a lot more than in South Carolina, in West Texas. I mean, all over the place. these diseases are coming back. If we are, as I said, we are almost at the precipice of a post-vaccine era, and if we are not careful and we don't stop it now, this will continue.
I remember when the World Health Organization declared that the world was measles free.
Yeah, well, the world can be measles free.
Yeah,
It can be measles free.
right.
Measles is a very infectious disease. People know about COVID. Let me tell you, with COVID, if you get infected, you can infect 1 or 2 people. With measles, if you get infected, you can infect 10 to 12 people. So
Yeah.
it is one of the most contagious diseases.
Yep.
And there is no treatment for it. Even, we have some treatment at least for some of the other bacterial infections, even though once the damage has occurred, then nothing you can do about it.
Yeah, I before you got on, Dr. Thor, I was telling Dr. Kane how whenever I'm around a lot of school age children nowadays, I get nervous because for me, I got to be a little paranoid during the COVID-19 era, and I know a lot of people have chosen not to get vaccinated, and so I just get nervous. I was just like, oh, okay, because children being around other children. So if I were a parent and I have made the decision to get my children immunized, we talk about the community, what the community needs to know, that when unvaccinated children are around vaccinated children, if those vaccinated children may be behind on their vaccine, could it cause potential risk to those children? They've been getting vaccinated, but the parents just is a little behind in the vaccine schedule.
Yeah, yeah.
Yeah.
There are studies that were done, I think they were in Colorado, that showed that if there are unvaccinated children in a school
Mm-hmm.
for pertussis, this is whooping cough, they would increase the risk even in those who are vaccinated, and also definitely in much higher increase for those who are unvaccinated. So I think, even no vaccine is 100%. We know that,
Right.
right?
Right.
Certain percent of people, even if they gotten the vaccine, they're not going to be protected. We know, and I know enough physicians who got hepatitis B vaccine and they are not protected because they didn't have a response to it. So I think it's all those children also who or not just children, or those individuals, for one reason or the other, cannot get a vaccine because of their immune system or what you may have. So I think if we are going to protect the community, we have to make sure all those who are eligible for vaccination are immunized. And, that's one of the reasons that, Justin, you were around in 91, 92 in Jacksonville when we had a huge outbreak of measles here. We had, almost 200 cases of measles here in Jacksonville. And we learned at that time in the early 90s that the one dose of measles vaccine was not sufficient because a certain number of kids were not getting protected. So that's when you realized, because a lot of these outbreaks were happening in colleges, right? Because those kids either they were, had not been protected, now they were exposed. So giving them a second dose, we now know protects them. We learned the same thing for chickenpox. You need 2 doses. So I think this is something we know the vaccines can protect. I don't think we want to make this a battle of parents versus the healthcare providers.
Yeah.
Those who believe in it. It is a battle with the media, with the social media, with the those unfortunately in power who, for whatever reason, are telling everybody you don't have to vaccinate. And can you imagine if school vaccination programs are stopped, the mandatory school vaccine? Can you imagine that? We know, for example, states like Mississippi and West Virginia, 2 of the poorest states in the United States, they had very strong childhood vaccination school entry programs, very few ways that people could get a exception for immunization, and they had the highest immunization rates and the least amount of outbreaks when they occur. We have had 3 in my more than.
Uh-oh, you muted.
He went out for a second.
There you
Sorry.
go.
In my more than 30 years in Jacksonville, we have had 3 cases of tetanus. One who had objection to tetanus vaccine because of religious reasons. One, a child who got the primary series but did not get the booster. And third was a child who was a child, American citizen, American born in the United States, but the child of immigrants who were undocumented, and they were afraid to go and get the vaccine. And they all three got for different reasons. So we, as physicians and healthcare providers, and those advocating for children, have to show empathy to all of these families and work with them as much as we can. Here's what it is. Some of them have made up their mind. There's enough social science data that those people who are adamant and have made up their mind, you're not going to convince them. Those who want to get the vaccine, they'll get it. It's those on the fence that I think we are our best opportunity to do that.
Dr. Rathor and Dr. Kane, I just knew you're muted, Dr. Rathor, but I just knew that because of COVID-19, a lot of people became more knowledgeable about herd immunity and the importance of vaccines. And although they may have experienced some folks in their family who died, or they knew somebody who had a family member that died, I never thought that it would get to this point that those routine vaccines would not be a normal way of life, because all of us saw that we took a chance. All of us took a chance on getting the COVID-19 vaccine, right? And I tell people, I said, there are a lot of things we take a chance on. A new restaurant, a new, pair of shoes or whatever. But we knew that those persons who were not getting vaccine, many of them were dying. So I took, it was a no-brainer for me. But I'm just so surprised. So I never thought we would evolve to this point after going through those 4 or 5, however many years of the pandemic.
Jocelyn, we take a risk when we step on a vehicle and go on the road.
Yes.
And what do? That we click our seatbelts. That's to prevent. That's your vaccine.
Yep.
Right. Yep. And then, in a disease, we wear a mask and we do gloves and all the cars, bodies, that protection you give. But then, God forbid we do get in an accident, the airbag deploys, right? And that's your antibiotics. Now, think about this. How many people were dying when the airbags were not there? Those are the diseases for which we have no treatment. Measles is on top of that. And I think even if the airbag deploys, there are still injuries. So even if you have the antibiotics, there are still going to be people who are going to suffer from it. So what is best, to be in your seat, and you don't wear the seat belt, we know the risk is high. So I think we do all these things to protect ourselves. And most of us go through life wearing seat belts and never get into an accident, right? Thank God, right? Some do get into the accident, and if they were not wearing a seatbelt, they may not have died from the accident, but certainly would have major problems. So I think we need to think of these. This is not any different in my mind.
You have a better chance of survival wearing a seatbelt and having airbags than you do not wearing seatbelts and no airbags.
Exactly.
Okay.
Yeah. Exactly.
One thing that I tell people I use quite a bit, and I use the example pretty much what you did just now, Dr. Rathor, is that, these people are taking advice from people who have the least amount of knowledge in terms of healthcare. And you ask these same people who taking advice from some social media climber, whatever, or politicians a lot of times, they take advice from them on what their healthcare need to look like. But those same people, if you ask them, well, will you go ask that guy to fix your car?
Yeah.
The they do is say, no, he's not a mechanic.
Yeah. I mean, just because I heard a mechanic on YouTube how to fix my car doesn't mean I'm going to
right.
Well, that's right.
And so I think that's a very good example, right? We are going to take greater care of our cars than our children.
Yes.
Think about that. Just think about how terrible that is.
Yeah.
And you don't have to listen. You don't have to believe everything a doctor says or your doctor says. But if your doctor is providing you some information, he spent his life and her life understanding that. And by the way, there's also this misconception that pediatricians or those who give vaccines make money on that. Trust me, they don't.
We lose money.
We lose money. But it is so important that I remember, when the vaccines, when H flu vaccine came, you didn't have to convince anybody who took care of children that we're going to do that. Now things are actually much better now, Rogers. You may remember back in the day, we didn't have VFC. We
Nope.
didn't have, all these contracts. We didn't have all these insurances. So people are taking a lot bigger losses. It's become a little better. There's still
Right.
some loss, but it is not as it used to be. So the pediatricians and those physicians or those people who provide vaccines, they are not making money on. They are not getting rich on giving vaccines.
Nope.
In
Nope.
fact, if we were really selfish, we would not give anybody vaccines. So people would get sick, and we'll take care of them, and that's when we get paid.
Yep. Yep. Yep.
That's a terrible thing to say, and
Yeah.
thank God that's not what people are doing.
Well,
So,
again, the more accidents people have, the better the automotive repair,
yeah,
the better that industry is. But we're trying to prevent people from getting sick, which
yeah.
really being sick is what put money in my pocket. Okay.
Unfortunately, that's our health system. So I think we not only have to educate people, we also want to make it easy for people to get vaccines. And the
Yes.
health departments serve such an important role in there, where you can go and get the vaccines. So I think that's another thing. We have to build up our public health infrastructure. I know this is dear to Jocelyn's heart, but I think we need to also look at that as a very important part of the whole vaccine provision.
Yep, I agree.
Yeah, and we talk about vaccine schedules. So there are different points of a child's life when they're to get different vaccines, from the beginning. You mentioned 2 months, 4 months, 6 months, 12 months. So those decisions of when they get the vaccines, that's something that information that they should be able to get from their pediatrician, their child's pediatrician, right?
Right. And that's and the reason, you can't, people say, well, we're going to delay the vaccines, or we're going to stagger the vaccine. That's not very helpful, because if you give the H flu vaccine at 12 months, your child is going to be at risk. We want to give the vaccine before the child is at risk. That's why the HPV vaccine to prevent carcinoma, vaginal carcinoma, is given at 9 years of age. So it's much before children get sexually active, because that's how you get the infection, right? Most of the time. So I think that's why you give the hepatitis B vaccine. We give it at birth for a reason. We know that 15% of the children, we never know how they get the hepatitis B vaccine. We also know if you get hepatitis B disease as a child and infant, you are much more likely to have cirrhosis and cancer. Hepatitis B was the first cancer preventing vaccine. We forget that. HPV was the second one. So I think there's a reason those vaccines are given at certain points in time. If we could, we would give the measles vaccine at birth, but we can't, because the maternal antibody can blunt the response. That's why we wait till 12 months of age. And so I think in parts of the world where measles vaccine are not as much available, the vaccines are given earlier. So I think there's strong scientific reasons to do this.
So what can trusted community spaces like churches and barbershops, what can they do? What role can they play in this? Should they just have candid conversations, just really talk about, make sure you're getting your children immunized. Make sure you're getting your vaccines. They're not going to use the word immunized, so let me just say vaccinated. Make sure you're getting your children. What would you say to them if they're in our audience listening right now?
Well, the places of worship, that we always talk about the sanctity of life and how precious life is and how it must be protected. I think the churches can play all places of worship can play a very significant role in educating people and saying this is important. You're protecting your children. That's one thing. I think, and barbershops, I don't know how many of you remember Liz Means. She taught me decades ago that if you want to make an impact, and especially for the women, you need to go to the barbershop. And I remember back then we were talking about HIV infection, and she said, it was, she taught me that. And so, I think barbershop is one place, but there are other places where people gather, and there are people of influence there. We need to be there. We need to educate them. I think the obstetricians have a great role to play in educating women, because women are often the healthcare decision makers for their children. I'll tell you the story. I know you may not have enough time left. When Obamacare first came, the first year, I was making rounds in the hospital. There was this child who was admitted, and he was very sick, and my parents were there, and I told them, hey, listen, they had no health insurance, that now you can get basically free health insurance. And the dad was like, oh, I don't want any of this. This is, communism, whatever. And so, okay, I said, I'm not going to be able to force you. So the child was sick. So I came back in the afternoon to look at the child again. And the mom was there by herself. And she said, can you please tell me more about the insurance that I can get? And I was like, sure. And so I got somebody, we got on the phone, we got them the insurance. I don't know if the dad knew about it or not, but, the mom knew that how important this was, and so she got it. So I think anywhere we can influence people who are decision makers, which are parents and grandparents. Don't forget the grandparents. Grandparents can have a significant influence, and many of the grandparents have seen some of these diseases, so they can tell how when they were young there was a schoolmate who never made it, or a schoolmate who got brain damage because. So I think these are things that we need to focus on. Parents, grandparents, influence barbershops. I mean, all those places, and don't underestimate the radio stations, especially some of the hip hop radio stations that have a great influence.
Well, many of the grandparents, truth be told, many of the grandparents are raising the kids, or the kids are in their household.
Right.
Their kids in there, which means the grandkids are in there, because the way things are structured these days, it's difficult for a lot of these parents to survive, young parents especially, on their own. So they're living with their grandparents. So grandparents play a huge role in terms of influence.
Absolutely, you're absolutely right. So I think we need to think of innovative ways of getting to people and saying how these things are important. I think there's a whole culture of mistrust of authority, of power, of government, of people. And they look at healthcare providers as people in authority and power. I wish that was true, but that's not true. So I think that's the reason, and I think if we could get the message, we really don't. We don't make any money on vaccines. We lose money, and we do it because we really believe. And frankly, the other problem is, and this is happening also. Some of the young physicians have never seen these diseases, so we have to educate them. And we do a great job, I think, in our training programs to educate these physicians and say, how this is important. And unfortunately, there are still going to be some out there, from amongst our own brethren and sisters of the healthcare system, where they are spreading the wrong information.
One of the things about, and you brought that up for not intentionally, but it brought it up for discussion in terms of access to physicians. There is a diminishing number of physicians out there. No disrespect to any other additional healthcare workers, but many of them have just given up and retired early because they're facing the onslaught of anti-healthcare.
We are seeing that people refusing vitamin K.
Yeah.
Can you believe that? I mean, I did never believe in my life that I will see a time that people will even refuse vitamin K. We had there was a report about the 2 cases of tetanus in children who were delivered, I believe, out of the hospital in one of the birthing places. I don't know where they were from, but I mean, those are the sort of things that are happening. People are, when in the richest and the best country in the world, nobody should in this day and age die of a vaccine preventable disease or have a devastating effect vaccine preventable disease.
Exactly. Nobody.
Dr. Rathore, don't go anywhere. I forgot, I was so busy talking and so excited that you got on. I forgot we have what we call a mid-show moment. But before we do our closeout with you and you're giving your closing remarks, I'm going to ask Tyrone to cue up the mid-show moment, and then we'll get right back to you, Dr. Rathore, for our final thoughts.
Okay, thank you.
Welcome to Pause for the Truth Mid-Show Minute. Today is Tuesday, April 21st. I'm keeping this tight, human, and focused on our families, especially Black families, because protecting our babies is protecting our future. Here's the headline. Infant immunization isn't just a medical win, it's community infrastructure. From barbershops to churches, aunties, neighbors, what we do together shields the smallest among us. Quick rewind. In 1796, Jenner kicked off the first smallpox vaccine. By 1853, Massachusetts said kids needed it for school, and child death rates dropped. For decades, schools hosted vaccination days. Nurses lined kids up, checked consent forms, and gave routine shots right on campus. Fast forward, 1948 gave us the combined DTP shot. 1955, Salk's polio vaccine turned a national fear into a fading memory. Wild polio was gone in the US by 1979. 1971 brought MMR, measles, mumps, rubella, at a time when measles alone killed hundreds here each year. And then the game changer for access, the Vaccines for Children program in 1994. Since then, routine childhood shots have prevented about 1.1 million deaths and over 500 million illnesses for kids born through 2023. That's not abstract. That's millions of Black children growing, graduating, thriving. Now, the science of community, herd immunity. Think of it like a neighborhood shield. When enough of us are immune, a virus struggles to find a host. Measles spreads fast. It needs about 93 to 95% of people protected. Polio needs around 80 to 85%. And here's why this matters for infants. Some vaccines, like MMR varicella, can't be given until after 12 months. Until then, babies lean on us, their parents, siblings, cousins, and community to keep that shield strong. When coverage slips, outbreaks hit the youngest, first, and hardest. So what's new in 2026? Gold standard research, more placebo-controlled trials and long-term follow-ups to give parents transparent, specifics over slogans evidence. A revised schedule, a focused core of universal protections. Shared decision-making options tailored to a child's risks, done in partnership with your pediatrician. Next-gen delivery, microneedle patches that dissolve on skin. Mucosal vaccines, sprays. Mucosal vaccines, drops, less pain, more protection. Synthetic biology, mRNA. Recombinant tech pushing multivalent vaccines. One shot guarding against multiple strains, fewer pokes in that first year. Here's the real talk. Access and trust must travel together. The data is strong, but it lands best when delivered by people we trust. Black doctors, nurses, faith leaders, community health workers. Ask questions. Get clear answers. Protect the village. Action steps you can take today. Check your child's shot record. If costs a worry, ask your clinic about vaccines for children. Keep your own boosters current. You are part of the shield. I'll leave you with this. Numbers protect, but people decide. Choose protection. Choose community. Choose a future where every Black baby gets to grow up strong.
Wow, Tyrone does a great job. Thank you, behind the scenes guy. That's his new name. It's not Tyrone anymore. It's behind the scenes guy. Dr.
Powerful.
Thor, we thank you so much for joining us tonight. At the end of every podcast, we like to give our guests an opportunity to share their final thoughts. What's your final thought and main takeaway that you'd like our listeners to leave with tonight?
Well, think about this. Vaccine has one major side effect. It creates adults. And make a date to vaccinate.
That's
I
good.
think that I want to end at that.
Wow, can't say it any more clearer than that. Thank you, Dr. Athor. Dr. Kane, what are your final thoughts?
That's hard to come behind that one. Vaccine
I know,
for
right?
adults. Okay. But then once they get to be adults, they fall into my realm these days. So then I still got more vaccines for them so that they can become old adults.
Is that it, Dr. Kane?
Yeah, that's it.
Dr. Rathor, thank you so much for sharing your time, expertise, and insight with us this evening. This has been an incredibly informative and meaningful conversation. To our listeners, we hope tonight's discussion has helped bring clarity, confidence, and understanding about the importance of infant immunizations. Protecting our babies is one of the most powerful ways we can protect our future. Remember, staying informed and connected to trusted healthcare providers can make all the difference in ensuring our children get a healthy start in life. Thank you for tuning in to Pause for the Truth podcast. Be sure to share this conversation with your family, friends, and community. Until next time, stay informed, stay empowered, and take care of one another. Good evening.
We appreciate you spending time with us on Pause for the Truth. Ms. Jocelyn Turner and Dr. Rogers Kane are grateful for your support. Don't forget to like us on Facebook, catch us live on Twitch, and most importantly, subscribe on YouTube. A big shout out to Tyrone Jackson at Call Tyrone IT Services for keeping us connected. Join us every Tuesday at 6:30 p.m. Eastern Standard Time for more enlightening discussions. Thanks, and see you next week.